In this video, I am going to tell you how to identify the structures on the posterior aspect of the posterior compartment of the forearm. Now, there are total 12 muscles in the posterior compartment of the forearm, which are all supplied by the branches of the radial nerve. The branch of the radial nerve which you find in this compartment will be the posterior interosseous nerve, which will be accompanied by an artery, the posterior interosseous artery, which is a branch of the common interosseous branch of the ulnar nerve. Now let's identify the muscles first. So of the 12 muscles of this compartment, 7 are superficial, 5 are deep. Of the 7 superficial, 3 form the lateral group, the brachioradialis, extensor carpi radialis longus and extensor carpi radialis brevis. These 3 are better visible from the anterior aspect of the forearm because there are no intermuscular septa between the anterior and posterior compartments in the forearm. So we have already seen these 3 muscles in the anterior compartment of the forearm. Now the medial 4 muscles of the superficial group are: one is this triangular smaller muscle, the anconeus, which is attached to the ulna, and you see it behind the elbow joint. There are 3 tendons which go to the hand. The medial most is the extensor carpi ulnaris, which will end in the carpal bones, as the name suggests. Then extensor digiti minimi will go to the little finger, and extensor digitorum gives 4 tendons to the 4 fingers. Now digiti minimi and digitorum tendon to the little finger, you will identify the digiti minimi will remain medial to the digitorum tendon. You see, you won't be able to see this part in the dissected body because it is again covered by extensor retinaculum. So how you are going to confirm? Again you will pull the tendon and confirm that this tendon is digiti minimi. And again, how you identify the tendons? You trace the tendon above which are continuous with the muscle belly. This is must for identification of the tendons because they also look like the nerves which are glistening. Now of the 5 deeper muscles, one is supinator, which covers the neck of the radius from posterior, lateral and the anterior aspect. So to see it, you have to retract these lateral muscles and see it. It also forms the floor of the cubital fossa, so you have already seen it in the from the anterior aspect. Rest of the 4 are tendons which come to the hand, dorsum of the hand. The uppermost and the lateral most one is the abductor pollicis longus, then is extensor pollicis brevis, then is extensor pollicis longus. So these 3 tendons are going to the thumb. So again you will pull. So from above downwards and from lateral to medial, you see abductor pollicis longus, extensor pollicis brevis and extensor pollicis longus tendons. The 4th muscle is extensor indicis, goes to index finger. So again, like the little finger, the index finger has 2 tendons. One is the medial one and one is the lateral one. So the medial tendon is that of indicis. Right? Now other than this, so how many tendons you are actually getting in the posterior compartment of the forearm? You are basically getting 1, 2, 3, 4 of the superficial group muscles, and you are getting 1, 2, 3, 4 of the deep group of muscles which are properly exposed. Other than this, you are going to get one nerve, which is the posterior interosseous nerve. So you will again identify it by tracing it above and down, and you will see that it is not continuous with any of the muscle fibers. And it is accompanied by an artery, posterior interosseous artery. You know that arteries below the elbow are all accompanied by veni comitatus. So you are getting the muscles, one nerve and one artery over here. Another artery you may get in this position, that will be the radial artery, which has come from the anterior to this posterior compartment.